Hi everyone, my name is Ashley Ryan and my presentation will be on applying project planning and community development tools in an organization. I attended my practicum at Be Connected Support Services. This is a multi-service organization that serves and supports a wide range of community members with developmental disabilities. They provide customized person-centered services that range from residential, day school replacement, and outreach options in Victoria and surrounding areas. Be Connected is funded through Community Living BC and Ministry of Children and Family Development. It is an accredited organization that is currently serving over 140 individuals. During my time spent here, the Be Connected team has been preparing for their upcoming 2017 CARF accreditation survey. I participated in this process by sitting in on the strategic planning meeting to learn how an organization prepares for an accreditation. This is a part of Be Connected's commitment to continuous quality improvement and to address the organization's strengths and areas for improvement. A part of this learning opportunity allowed me to put to practice using basic policy development skills to update policies and procedures that were required in preparation for the accreditation. Aside from getting to understand how an accreditation works, I had the opportunity to participate in an all-day trauma-informed practice workshop. This allowed me to understand what kind of care is needed to support individuals in this field. Additionally, I attended several meetings which allowed me to learn about the delivery of services and the inner workings of this organization. Lastly, my practicum experience also involved a variety of tasks that focused on creating culturally safe and comprehensive information packages. To create these packages, I used interprofessional practice and stakeholder engagement in identifying that the supportive independent living program would benefit from an extensive resource guide and additional items to include that would be used as a starting guide by the SIL coordinators. They would refer to these packages for accessing a more consistent and relevant information system when delivering support. These packages are intended to connect individuals with developmental disabilities to the services and resources that are relevant and helpful for daily living. The next project I worked on was to create diverse information packages that draw on providing knowledge around different cultural categories. This would be called a culture kit. In order to create these packages, I gained knowledge around several diverse cultural categories that are commonly sought out by the individuals being served in the BSS programs. My involvement was to implement evidence-based literature using internal and external resources to create several subcategories into booklets. These culture kits are intended to be used as a guide for providing accurate information when a resident is inquiring about a certain cultural topic. The packages described are an example of using project planning and community development tools for creating opportunity and optimizing personal growth and knowledge. They work to offer diversity and inclusion in the community for the individuals served at BSS. The PHSP Skills learned over this BA program has guided my abilities to create well-rounded projects, community development and capacity building, interprofessional communication, critical appraisal of health information, as well as cultural safety and competence were all incorporated into my work performed during my practicum placement. By developing these skills, I am now capable of understanding how to assess community-based service needs and increase functioning to provide efficient and effective, culturally safe and comprehensive information for person-centered care. Additionally, the key insights I will take away from this practicum experience and BA program are that effective interpersonal relations can really make a difference in delivery of services. Finally, understanding how the determinants of health are all interconnected and impact our overall well-being. This is influenced by this influenced my work performed by aiming to improve health and reduce health inequalities for the individuals being served at Be Connected. This piece of knowledge can be used to make a difference in improving people's quality of life. And finally, I'd like to say thank you to the Be Connected support services for letting me be a part of their team. Thank you to all the faculty of this program, to all my classmates, and to my family and friends for the support.
So, some tough questions there for Ashley.
Thank you, Ashley. Can you tell me what you found to be the greatest challenge in meaningfully engaging with self-advocates around planning or integrating their desires, their needs, and so forth into the documents that you've prepared?
Yeah, so I attended, it was called Self-Advocacy for a Brighter Future Committee, and it was all of the individuals in the home care, and there was just one of the supervisors at Be Connected ran it, and they gave information on what is important to them, and their experiences with employment and just being involved in the community. And so when I collaborated with my supervisor, Chelsea, it gave me ideas of what information could be provided to better support them being a part of the community. Does that answer the question? Okay.
Any other question? I've got one for you, unless anybody else got a question. You mentioned the process of accreditation.
Yeah.
Looking back from that, I mean, obviously for many organizations it takes a lot of resources to complete the process, and it's somewhat stressful. How do you view that process? Do you see it as something that's been very valuable?
Yes. I think that there was so much information, and every part of the organization is a part of this process. So I think it's definitely a way for everyone to come together and assess their own participation in the organization. But it is a lot to cover, and like every single document and policy has to be gone over. Okay.
Well, thank you. All right. Well, thank you very much for an excellent talk.